Check 1, 2.
Well, hello there, boyfriend. How are you this fine day?
I'm really good.
Is it working?
Yes.
Excellent. Let's not touch shit.
I'm afraid to ask, but I have a great question.
I don't even know what I was going to say. I'm so disturbed right now.
This is Afraid to Ask with Jamie, Dr. Erika. I'm going to ask you a question I think I'm afraid to ask, but I'm just going to do it right out of the gate.
All right.
Last night, I feel like we have a very healthy sex life. Do you agree?
Yeah.
Last night, there might have been sex last night, but we weren't sure, right? And then we're in the kitchen, and I was talking about snoring because I'm going through a thing where I'm trying to figure out like why I snore, and I'm trying all these different devices. And then you said something like, "Hey, by the way, everybody farts when they sleep." And you know I hate fart. I was like, oh man. And then you were like,
oh yeah, because your device would record it if you farted instead of snored.
that's what made you say it.
I thought it'd be kind of funny to hear that.
And then you go, and when you die, you're going to shit yourself probably.
Yeah.
So I was wondering,
Yeah.
is that the same as saying, hey, let's not have sex tonight? Was that why you told me that stuff? Or was that unrelated?
It was just like a fun fact.
Okay, well, it worked for both.
I was talking about how like when you're asleep, you can't control yourself. So people often will be like, I never fart around my partner. But you fart at night because you have a relaxation of your anal sphincter. So it just happens. Don't say anything. And then when you die, a lot of people have that same relaxation because they don't have any muscle tone immediately. So they will defecate.
That's the only time. Sleeping is the only time where I relax my sphincter. All other times, I'm on the
High alert.
lookout. Even during heterosexual sex, I'm like, hey, let's keep our hands to ourselves. High alert. Do you know that's the thing? Sometimes
No, continue that one.
there's this new thing going around. The kids are trying it, where you got to be careful. Sometimes a woman will start to head towards that area of your body, and I kind of have had somebody kind of go in that direction. I had to go, hey, no means no. Okay? That's when that's the precise moment I stopped letting my anus ever relax. Was that moment. Does that surprise you?
I just have so many different drays I could go with this, and I don't know what one I want to take. How far did she get?
Not far. It's
Like halfway behind the ball sack?
she was headed it was circling the drain.
Ew!
Kind of like,
Ew! Wait, you mean like your butthole's a drain?
yes.
Oh, I was thinking like your penis was a drain, like the pipe, and she was like going around it, like circumnavigating.
I apologize. Maybe not a great metaphor.
Is that where they came up with the ringer?
Ring job? Rim job.
Rim job. It's a ring job.
I'm not 100% sure what that is.
I just feel like now, whenever you're talking, I'm going to go, whoop.
Let's not do that. We have a lot of questions that we have to get to.
Okay, well.
Usually at the beginning of the episode, I like to ask you, hey, what direction should we go? But this time, I think I would like to
Around the ring.
choose for you. Would you mind that?
Yeah. But make it like a good one. A punch.
I have a question coming in
Straight to the face.
from about a colonoscopy.
Not the punch I wanted.
We've covered colonoscopies, right?
Yeah, kind of a lot.
Extensively.
What else do you want me to... You talked about assholes today already. Is this like your theme?
This is a good segue. I would not ask you this question if it wasn't something we did not cover last time. We talked about me getting colonoscopy, pre and post colonoscopy. This question I have not heard before, and I did not have this experience. It's a very specific question. I don't know if you're going to be able to answer this. I don't even know if this is a medical question. I'm going to play this. Here we go.
Hi, Jamie and Dr. Erika. My name is Mark. I live in Valencia, California. So here's what happened to me. I got done with my colonoscopy. I'm in the recovery room. I'm groggy. I'm just waking up. So I'm sort of half in, half out. Then I felt very bloated. I felt very gassy. And I farted. And it was so long. It was so long that I knew no one would believe me when I told them how long it was. And matter of fact, when I was done, I go, did that happen? I go, or did I dream that? I couldn't even, all of a sudden I went, wait a minute, I think I have another one. Luckily, I had brought my cell phone with me, so I grabbed it, and I had enough consciousness to sort of hit record. And I recorded the second one. It was 24 seconds long. And that one was a fraction of how long the first one was. I'm sure if you combine the two, well over a minute. I guess my question is,
impressive.
How is that humanly possible? Where did the error come from? And why don't they give you a heads up beforehand if this is normal so that you're not freaked out?
I thought you were going to say he actually recorded it and was going to let us hear his 24-second fart. I would have enjoyed that.
Well, did part of you when you heard that think, oh, that's fake? Did any part of you think that's not real?
I don't know about 24 seconds.
Because I did. When I heard it, I go, that's not real. Do you have what are your opinion on, is that a common thing? I've heard you have to fart before you leave, like they make you?
Well, it depends. Not everyone does this anymore, but oftentimes they'll insufflate your colon and your intestines. So put air inside to help see if the visualization is impaired.
Do you know that's why I don't relax my anal? Because I'm afraid someone's going to inflate my colon. So I keep it.
Inflate your colon.
By the way, this is a true question.
It's not a common practice for everybody now. So you didn't have that. So no air was pushed inside of you. So they didn't say, hey, try to get your bowels moving and try to push it out.
I see.
But yeah, oftentimes if you have a lot of air put in, you have a lot of air come out.
What I'm saying to you is though, this is not fake.
No, I don't think so. That's why it didn't. I wasn't
thought it was. I don't like fake questions on podcasts.
No, that's real. Absolutely. I've heard long farts. I haven't ever timed a 24-seconder, but
I wasn't going to play because I actually thought it was a bit. So I messaged this person. And I go, you know what? I really don't like. I just heard a podcast where the question was so fake and it infuriated me. And so I go, I'm not trying to say you're lying. And I go, but are you doing a bit? Are you whatever? And I go, you said you recorded it with your phone. And they go, oh, do you want it? Do you want it?
No, you don't have it. I was joking.
Yeah. So I go, what do you mean you still have it? He goes, oh, because it's on the front page of my phone.
No.
Okay.
Okay.
Ready?
No, I was so sarcastic.
24 seconds.
I don't think that was 24 seconds.
I think it was 24.
And it sounded like a balloon.
You're now questioning the validity of this person's...
Yes.
Oh, wow. It's a real fart.
How do you know that?
That's not a balloon. Do you want to know the honest truth?
Yeah.
Give me 1 second. You know what my favorite thing is? The fact that I'm laughing so hard and you're so unamused. I think that's all of men versus women. That struck me so funny. I actually know that it's real because I heard this story before we had a podcast, and so I searched this person out to hear the fart.
I guess it doesn't amuse me. I don't know.
That's weird, right? I'm not saying I don't know which position, but I can't not laugh when there's a 24-second fart. It's impossible. But you were like, I think it's a guy-woman thing. Anyway, I
don't know. I think also I'm used to like performing surgery and afterwards not letting patients go until they've had a bowel movement or passed gas, because oftentimes the medicines we give cause constipation, especially opiates for pain control. So after surgery, you want to make sure that the gut motility is there before you discharge someone so they don't go home and have a bowel obstruction. So a lot of times I'm like, hey, you can get out of here as soon as you fucking fart. And it's totally serious.
Okay.
Yeah. So like it's a thing. And then someone will fart and you're like, yay. And it's like a genuinely like, so
Wow.
I don't know.
Can I admit something to you? I didn't even care about that medical question. I wanted to play the fart noise for
Oh, you want to play the fart
But
noise?
you had a great answer. So I'm glad we did it.
Well, sounds don't bother me. Smells sometimes bother me.
What's your worst? I don't even want to talk about this because I have a gag reflex for mine. So I don't even know if I want to talk about this, but you're a doctor. I assume you are like maybe more used to body fluids and smells than other people might be. Do you have one thing where it's like, I can't?
Melena.
Melena? Really? Obama's wife? No, Trump's wife?
Well, first of all, if you're gonna like dog a presidential
I was trying to think of the name.
first lady,
The name of
maybe
the
get
person.
them right.
Melena seems like a combination of Michelle Obama. Seems like a quick way to say her name.
No way to try to recover her.
What is that? No.
So it's digested blood for an upper GI bleed. So say you're bleeding in your esophagus, your stomach, your upper intestine, your body will break down the blood, and the heme, the actual molecules and components of the blood, when they break down, actually turn black and tarry. So you poop out, it looks like black tar. It's that sticky and it smells terrible. And I've seen it in a pool, like it came out of a patient and it was just like a huge bucket of black tarry poop, and it smells really bad, and it's awful because that patient ended up passing shortly thereafter. So like it's not a joke. Like when you have it that bad, it's a big deal.
I've had a shit like that where I was like, I think this is it.
I think it's interesting that like stuff doesn't faze me, right? Like if you eat beets, like I eat beets a lot in our smoothies when we got, right? My pee is like blood. My poop is like bloody, and I always am like, oh fuck, oh yeah, we just had a blue. Yeah, I know, it's sexy, right? But it's like bloody. I think it's interesting. Like Pepto-Bismol, did you know makes your poop black?
I never taken
And
it.
your tongue too. So people be like, oh shit, I have black stools. Like what do I do? But it's not the same. It's like this black. It's like tar, sticky. Urine. Do you know we call one Coca-Cola urine? It actually looks like Coke. Your pee looks that color for a certain disease process. So anyway,
So
that's
your
the
answer.
worst smell.
You're the winner. Don't even want to say mine.
That's why the fart noise doesn't faze me because like I don't smell anything. What are you gonna do? I'm hearing something. I'm impressed that it was real.
Yeah, it was 100% real. And think about if we had audio of that first one. That'd have been pretty cool.
I'm more so impressed that from the sedation he was able to think enough to record his fart.
Yeah, that's something. This is the kind of guy that does not surprise me that he was able to do that. But yeah, I agree with you. He had this state of mind to do that.
The next time, like, well, if I ever meet this friend, that's all I'm just gonna be like fart, 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 fart. I'm just gonna like look at his face and just hear that.
You meet this friend. And he will convince you. You'll totally believe him. I have my grossest thing is I don't like
the grossest
boogers.
smell.
That's my worst like throw up thing. I want to move on quickly if that's okay because
No, I kind of want to do this.
I almost vomit when
Let's do it.
If there's a child and there's any kind of ingesting or something, it's the grossest, most disgusting thing.
Ingesting,
like eating a booger.
Oh!
I also like
see.
pimple videos, but that's way above it for me. I think it's the most disgusting thing.
You're not dry heaving right now.
I didn't dry heave, but I definitely had a legitimate...
Can we play a game of like I tell you the grossest stories I have and we see how many you can get through?
Yeah, we'll see how to get rid of as many listeners as we can as fast as we can by grossing everyone out.
All right, I want to tell you one. You ready?
Shit, okay.
If you don't want to, we don't have to.
Okay, I'll do one.
Just don't puke on my bedroom floor.
But I can't even handle the... Okay, God.
All right. Have you, since you talked about snot, I'm going to start with that one.
I can't.
Have you ever...
I can't.
Have you heard of something called
know
a
what?
nose Frida?
I can't do it.
A nose Frida. Do you know what that is? It's for babies.
I do know what it is. I can't do it. And I know what you're going to say.
No, let me do it. Let me do it.
I already know the story.
Let me do it.
My ex, I'm going to throw up my ex.
Let me do
one
it.
Of these,
And
I just watching it happen was so so disgusting, and I know what your story is. I can already tell what it's going to be.
let me do it.
Go ahead, I won't listen.
All right. So it's for people who don't know what it is. It's a long tube with a suction thing on your mouth for one side and a little sponge filter. And then you stick the tube into the infant's nose and you suck to get all the snot.
Can I just do a disclaimer? If anybody's not want to hear the story, it'll be 45 seconds.
I don't even think it's that gross. So to get the snot out of the baby, because babies can't blow their nose. So when they're really congested, you want to clear it all out because then it won't drain and cause issues with it going down and having them cough it up. So you are supposed to suck snot
I know.
with your mouth out of a baby's nose, right? So I got really good at it. I was like babysitting
I might have
and
to
I
walk
was like
away.
rushing. So what you do is you take nasal saline, like saltwater spray, you squirt it up the baby's nose so it makes the snot even slipperier and slimier and easier to come out. And then you stick the nozzle in and then you put the other side in your mouth and you suck out all the snot and you see it in the clear tube coming up. The problem is I forgot the filter. So I sucked as hard as I could. And all of the baby snot went straight up into my mouth. You're fine. That's the whole story. You did great.
It's the grossest thing I've ever heard. And you know what the problem with that story is?
But you did great.
I'm
You
never
didn't
gonna
even
forget it.
drive.
I'm never going to forget it. That's a very gross story. Holy
You
shit.
did better than you gave yourself credit for.
Okay. I did plug my ears at the end, but I think I know how it ended. I saw where you were going. Hey, we have a new feature on Afraid to Ask.
Are you mad?
No, I'm not mad. I almost threw up, though.
You did drive, but that was when you were telling the story. When I told one, you did fine. Good job. You could be a doctor.
Do you know we have this new feature on Afraid to Ask where people can, it's called Speak Pipe, which people can leave us messages
That's
on
a terrible name.
Speak Pipe?
Speak pipe, like speak into the pipe.
I think so. Speak Pipe. And people can leave us messages on social media, on our Twitter, Instagram.
You're not even looking at me. I feel like your eyes are still watering.
It really fucked me up a little bit. But I am looking at messages people have left us on SpeakPipe. Oh, you don't have to apologize. I think I'm maybe in the minority here.
On snot or speak pipe?
Snot.
Oh, okay. Well, let's move
you
on
think?
because I feel badly that I made you feel sick.
These pimple videos have millions of views, and that to me is the most disgusting. I was working with an actress once in a television show that everyone would know who she was. Beautiful woman. And my stomach does hurt. In makeup, she would watch pimple videos the whole time. She was obsessed with it. There was like some Mr. Pimple or something.
Dr. Pimple Popper.
It's like Dr. Squish, but
Sandra
for
Lee.
pimples.
I get my eyebrows done the same place as her. She's awesome. I watch her videos. I have a couple.
Then I'm in the minority.
You know what's interesting? One of the best videos I ever did on TikTok that got 4 million or so views.
Yeah.
So it's not like a ton, but it got enough. Was pimple popping one. And the thing fucking explodes like
was
10 feet
yours?
up in the air. Not my personal.
Oh, a reaction? Uh-huh. I fucking hate TikTok.
I
Erica posts on TikTok.
like it.
She's like, I'm going to get 2 million views real quick. I post a video that got millions of views on Instagram, and TikTok's like, you watched it as you were uploading it. And that's the last person that watched it.
Well, that's what I think is interesting is social media is kind of like a wash. Who knows when someone's going to like something or not. Like the dumbest videos go viral and like really interesting videos have
true.
barely any views sometimes.
That's true. So here's what I thought I would ask you. I have some of these speak pipe questions, and there's some that I listened to them, and then a couple of them came in just now, and so I don't know what they are. And so would you like to, should we just go random to the phones?
Are these filtered at all?
No, this would be, I would just play it. And
So they
not
could say
filter.
anything. Fuck it.
Are you worried about that? Now you got me worried about it. Let's just see what happens.
If you want me to listen to it, yeah, you just played me an audible reel of farts, apparently.
All right, we'll just go to we'll go to speak pipe. Here's the first one.
Dr. Erika, should all broke losers date doctors for free health care?
Maybe we should get a screener? Should we hire a...
Did you know that was coming?
No, I didn't fucking know that was coming. I should be... What the fuck? I do have health insurance right now.
Maybe we should
can I ask you a
rephrase it
question?
that you're my guinea pig. Maybe I'm still learning on your body.
Can I ask you a question?
What?
That hurt my feelings a tiny bit, that man's message.
It
Do you
wasn't
think
true.
people are just joking? Or do you think they're trying to hurt my feelings? You think he's just joking, right? Do you think that person probably likes me and he's like, oh, that Jamie has a good sense of humor? And then I take it too seriously. He's probably a fan or something, right?
I think so. You always talk about being a broke loser on TV.
I
so
do.
I feel like you set yourself up for it.
Great point. Excellent point. And the fact that everything he said was true.
No, and I think it's funny because it's not true.
I have health insurance right now, Writers Guild, because I wrote The Animal too.
Huh?
Because when I do regular comedy, I don't get health insurance. But if you write a script and you make a certain amount of money, you get this incredible insurance. And because we wrote The Animal 2 last year, I actually have pretty incredible insurance.
Well, then I guess I'll date you.
Okay. All right. Maybe do you want to go to another one? I don't know what to do. Let's, all right. Let's see if there's
You
any
know
more.
why I thought it was funny, though? Because it's not true. If it was remotely true, I would be like, what the fuck?
You're right. It's because I do say that on TV. Of course, people are going to make jokes.
Did
like
I
that.
not just say to you, like, if I say something like, oh, it's because you have a little dick, it's like a funny, like, there's no way it's a true insult. If you had, like, insecurities about the size of your penis,
would
or
say
I
that,
honestly thought your penis was small,
Yeah.
that's not something I would say.
I hear what you're saying.
So I think this is the same thing where it's like, oh, you're a broke loser, ha ha ha, not, I don't know, maybe something that actually is personal and true that would hurt your feelings. So I don't think that one's bad.
I'm an oversensitive motherfucker.
Also, I think
You're
people are just
100%
going
right.
to come at us. So if that's the worst thing that they say,
That's true. By us, you mean me. The
no, I'm waiting.
Gutfeld, by the way, that's why he makes jokes about my children, only because he knows that we do have a good relationship. If we had a bad relationship, me and my kids, he would never, ever say anything like that.
Yeah,
That's
that'd
what,
be mean.
Yeah.
Right?
Okay, should we do another one? I'm fucking scared now. Are we ready?
Hi, Jamie, Dr. Erika. This is David in Miami, once again, with yet another question. Doesn't matter how much I sleep, people are constantly telling me that I look tired. I do have a 1-year-old, and some nights I sleep 4 hours, some nights I sleep 9 hours, if she lets me. And I'm always getting the same comments from people. So what do you recommend? What's the right... How much sleep should I be getting? Should I get a new pillow, a new mattress, a new face, new friends? I would love to hear what you guys think. Thank you. As always. Bye.
You know what's funny? I hate to say this.
What?
I feel bad for this guy because this happens to me all of the time.
What happens to you all the time?
People tell me I look tired. So I feel bad for this man. And you know what? Fucking sounds tired. Didn't he sound tired? I went to the airport yesterday and they asked me if I wanted to check the bags under my eyes. I get this all the time. Is there genetic? Is this a genetic thing, or is there something he can do about this? Because I really do. I would all the time. People are like, "Oh, did you just wake up?" And sure, I carry a teddy bear and a blankie.
You are fucking bombing right now.
I am. You're the only audience, and it's not good. It's not good. What do you say to this man? He's got a 1-year-old.
Yeah. So that's the first thing. Okay. So actually, did you know that the most
No,
predisposing...
I did not. Just all of it.
Well, you might know.
Okay.
Because you actually said genetics. So I think you're right. On track. The most predisposing factor that leads to dark circles under the eyes, most common thing associated with
Boxing career?
No, it's your ethnicity.
Really?
Yeah, it's the melanin production and the way that certain people's genetics play into a factor, regardless of other external forces. So, depending on your ethnicity, you might have a predisposition to darker under eye
Do you mean because I'm
circles.
Italian or something? I might have some dark under eye circles.
Melanin, so like basically the production of pigment.
Okay, so if I have darker skin, wouldn't they be less noticeable if I had?
It can concentrate in that area.
Interesting.
Sleep, though, is a factor. So if this guy says he has a 1-year-old, yeah, he's not sleeping a lot. But he said some days I sleep a lot, some days I don't sleep a lot. So it doesn't make me think that he's not sleeping well all the time. So I would say it might be ethnicity. I don't know. I don't know who this guy is.
Can you not lose
the
your thought?
second
But can I
thing-
ask you one question?
What?
Do you do? I always heard, just to give a little more advice, I always heard sleep when the baby sleeps. Right? That's what people say.
Unless your baby doesn't sleep.
Unless you're, but they say like the minute it falls asleep. I did that. Like when I had kids, I'd sleep when the baby sleep. I would, when he would suck a nipple, I would go, let's do this, right? Just to stay in the same. What's the next one? Tough crowd today. Okay. Other reasons for looking tired.
Well, if you don't get a lot of sleep, you don't get a lot of oxygenation in return. If you're snoring or you're only sleeping a few hours, your body's overexerted. So you can be dehydrated, which can cause it, or it actually can cause your blood vessels to dilate with less oxygen received to the body overnight if you're not sleeping a lot. So it, believe it or not, puffs up your blood vessels. Deoxygenated blood is dark, right?
believe it.
When you see blood that's like bright red versus blue. Well, dark deoxygenated blood is the color you're looking for, and it can go underneath your eyes. So if it's dilated, it's darker. You know what's interesting, since we talked about buttholes, you know how people treat bags under their eyes?
Wait.
That's your hint.
Don't tell me yet.
There's your commonality.
I really want some time
I gave you the
here.
link. What's the
You're
treatment?
saying, how do people treat... Is your dog going fucking crazy, or is that a different dog?
That's not my dog.
Crazy. I don't even know if they can hear that. Let me check. Oh yeah. Okay. Well, we live in got a dog going fucking nuts. Can I have a real chance at this?
Yeah, I just gave you the hint, so go for it.
So bags under your eyes.
I just said vasodilation and buttholes.
Is it because you can't sleep because there's a fucking dog won't shut the fuck up? Could be. I don't know. What just made me think of that. Could it be treatment under your eye? I'm immediately thinking it's some sort of, I put a little like a face mask type of thing, but it's concentrated in there. I just set it on there, on the outside of it, like some kind of ointment, but I don't know what that has to do with my butthole. I give up. What is it?
Well, yeah, like, so you know how like some under eye patches have like caffeine in them?
Yes.
Or green tea, because it's supposed to vasoconstrict in a certain way. That's why caffeine helps with headaches sometimes, because those blood vessels dilate. The caffeine, like from coffee, squeezes them down.
Gotcha.
Well, same thing here, same concept. You've got that dilated blood vessel, the darker, the puffier, the hemorrhoid cream.
Oh, damn it. That sounds familiar.
Topical hemorrhoid cream constricts the hemorrhoid, brings down the swelling in your anus. Same thing, brings down the swelling here. You be careful, you don't want to get that in your eyes, but
Right.
you do want to put them around. So that's one option.
Nice tip. You know how you go to the store sometimes and you turn me onto this, and it is so surprising to me that sometimes there will be a medicine, one that I thought an over-the-counter, like a Unisom or something, that sometimes has the same... Oh, I noticed it with like an antifungal. One will be like toenail fungus destroyer, and then the other one will say rash prevention, and it's the same fucking thing.
Same thing.
Do they should do a hemorrhoid thing where they go, hey, under eye. Do you know what I mean? Because I have trouble putting something on my face if there's a picture of like a hot guy with his ass showing on the packaging.
Maybe they could just have like 2 chocolate starfishes right here.
Yeah, that's all I'm saying. With the same ingredients as hemorrhoid cream. What's your favorite amount of sleep? I know this is super. It's mostly opinion, I guess, but maybe not. What do you think? Like, how much sleep at night? Are you an 8-hour a night person? What do you personally do?
Well, the medical guidelines currently recommend 7 to 8 hours overnight, but that's also good quality, minimally interrupted sleep. So you want to reduce things like frequent urination. Nocturia can be a big problem if you're going 4 or 5 times a night. So making sure your prostate's okay. Sleep apnea, snoring a lot. People sometimes sleep 10 hours, but they feel like they've slept 1. It's not restorative.
This feels like an answer/personal attack.
Restless legs, so tossing and turning. A lot of times people actually have a condition where they can't sit still. That's usually associated with iron deficiency, anemias. Not always. Iron deficiency, maybe not anemia.
Do you think
so
there's
getting that checked and then having a supplementation. There's a lot of reasons people don't sleep well overnight. But yeah, our goal is 7 to 8 hours.
So you're saying it might be a genetic thing. He might just look like that. There's nothing you can do, or especially if he's getting the proper night's sleep. But he has a 1-year-old, so maybe that's the answer to the question right there.
Well, whenever someone says, I'm having a hard time sleeping, I'm like, okay, are you having a hard time falling asleep or staying asleep? Because there's other etiologies for each one.
Yeah.
Anxiety, depression can do it. Excessive caffeine use, obviously, stimulants, problems. Alcohol, we know that alcohol is a depressant. It makes you fall asleep usually easier.
But not
But then
quality
you
sleep.
wake up and you feel like shit after a few hours.
Yep.
So
and then you get woken up because you pissed the bed, you're changing the sheets. Now I'm wide awake.
Why did you say you?
Oh, just one. One has pissed the bed. Just in the example. I think that's a good answer.
Oh, thank you.
I do. I think that's a really good answer. But I feel like sometimes I sleep friggin' 12 hours and still look like I just woke up. So I don't know what to do about that.
I think it's because of the apnea from the snoring. And you're also not getting really good REM quality sleep if you wake up a lot. You don't go back into that restoration with the rapid eye movement that your body needs. Your adrenal glands, they're little tiny glands that sit on top of your kidneys. They spit out cortisol, right? That's that fight or flight hormone. Ideally, we like you to go to bed around like 10 or 11 because the early morning hours between like 2 and 4 is when those adrenal glands tend to kick in more. And if you don't fall asleep and give your body enough time to chill, it's like working overtime. So those glands are like, oh, fuck you, pew, pew, pew. And then you're just like that fight or flight hormone. And you've got all this stress hormone in your body. And that causes truncal obesity and irritation and mood changes. And it fucks with your level of energy and exhaustion.
I do feel like on a future episode, I don't know if I'm ready for this right now or if you are, but I feel like we should get into snoring at some point, because maybe not now, only because I'm doing like an experiment study of one, sample size one, me, because this really bothers me. And I mean, not kidding. It's embarrassing.
You can talk about it now. Why not?
Well, I just thought we are kind of almost up against time. But
I think we should talk about sleep though, because
we should. There's so many options though for this snoring thing, and
Yeah.
I did a mouth tape thing, I did a breathe right strip, and I bought this thing that was $350 called a Smart Nora, where it moves your head around. It hears you. It like hears you snoring and moves your head before you start to snore. And I have a app called Snore Lab that I pay for that tracks my sleep. And in the 3 days since I bought this expensive thing, it's been the worst snoring I've ever had in my whole life.
Yeah, but you're also sick.
I'm also sick.
You're congested, and I think that's why.
So that's why I thought maybe
The
we
study
could
is
report
flawed.
back. The study's flawed.
Yeah, it's not a double-blinded trial. I mean, we have to kind of reduce that expectation.
It's true. And sample
Start
size
over.
one, it is hard to learn anything.
Well, hey, I think we should talk about that in the future then, because I get questions about sleep all day long from patients.
All right, we tabled the sleep talk, and then would you like me to play one more
Yes.
random call?
Is it random, or is it another fart?
No, this is not a
Because you said that was random.
not pre-planned. Do you know, because I'm kind of sick, I can't, my words are coming like a tiny bit slower than normal. Like, I don't know if I sound fucked up.
You
I'm
don't
like
sound fucked up.
Okay, so I had an idea, because we do have to wrap up this episode. What if I play a clip of a question and then we go, let's do it next time? Does that sound
Okay.
But this is truly random. This is
I'm not commenting. I'm just listening, and then you're
we'll
cut.
We'll try not to.
Leaving them hanging.
Yeah, if it's a good question. Maybe you give a teaser. You go like, we'll talk about this, and then we'll jump off and do it next time. Should I just play one random one?
Sure. Let's see if I'm entertained or unamused.
Okay.
Someone I've been talking to for over a year tells me that he's Jamie. He tells me he loves me and he wants to marry me. But then I see this online that you're supposed to be his smarter half. Do you two have a relationship? I really need to know if it's really him or a scam.
Okay. I did not know that was going to play that. Let's wrap up. Let's wrap up. We'll get right into this.
Who the fuck is she?
Coming up on the next episode of Afraid to Ask.
You know, I think it's really interesting about how we always make the safe choices, right? Brene Brown talked about something like that, where you're in the arena. I do too. Whoa, what does that look for?
I love that lady.
So she talked about the arena and how, like, if you want to make stuff happen and you're comfortable just sitting in an arena and watching, nothing's going to happen. You have to be the fucking gladiator that's fucking scared shitless, that's in the faces of everybody else, that makes those tough decisions that nobody else wants to, or you're never going to get the spotlight. You're never going to get the glory. You're never going to get what you want. So if you're too scared to fucking do it, fine. You're going to take the safe route. Your life's going to be, meh.
Do you know what?
But you have to be fucking terrified to make those choices that take those exceptional people and propel them. Otherwise, you're just another spectator.